Good evening, and welcome to another edition of the Yuba Sutter Medical Explorer. I'm Dr. Robert Peppercorn. The purpose of this program is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices in our local area. We have a very interesting show for you tonight as we examine emergency care at Rideout Hospital. Before getting to our topic tonight, I have a brief medical news story for you. A new study is underway to determine if pills can prevent heart disease and cancer. Over 27,000 doctors nationwide have agreed to participate in studies to determine the effects of aspirin on heart disease and beta-carotene on cancer. Each of the participants in the study will take a pill every day for 4 years without knowing its contents. A recent Veterans Administration study indicated that patients with heart circulation problems suffered fewer heart attacks if treated with aspirin. Beta-carotene, contained in carrots and other vegetables, is converted into vitamin A in the body and has been reported to decrease the incidence of lung cancer in heavy smokers studied at Northwestern University in Chicago. At the end of this study, these scientists will be able to give a clear and definitive answer as to whether regular aspirin consumption reduces the total risk of death from heart disease and whether regular eating of beta-carotene reduces the risk of cancer. Now, on with the Medical Explorer. Yuba City and Marysville sit at the major intersection of more than 4 major state highways. The proximity of these roads places Marysville in the ideal location for a major emergency center. Rideout Hospital at 4th and H Streets serves as a full-service, 24-hour-a-day emergency medical facility. We're now at the Rideout Emergency Center in Marysville. Have you ever wondered what might happen if you were involved in an accident? What would it be like to come into an emergency room lying on a stretcher, seeing strange people doing a lot of different things to you? Well, in a moment you're going to see for yourself.
Rideout 110, Med 6, 804, the request for orders.
Marge, request for orders. This is Rideout, go ahead.
Rideout 804, on scene at this time. Have a 19-year-old male patient involved in a motorcycle accident, ran off the roadway, striking a fence. Upon our arrival, the patient was found conscious. He does respond inappropriately to command. He has an obvious fracture to the right femur area. Also has obvious chest injury. Lung sounds appear clear bilateral, although are very, very diminished. We have vital signs. Blood pressure is 80/40. Pulse rate 120 and weak. Respiration is at 32 and shallow. There was some loss of consciousness by per witness, although unknown length of period. Pupils appear pearl. We have applied the hair traction. We're placing him on a backboard at this time. I'd like to go ahead and start an IV lactated ringers and titrate your blood pressure, please.
Go ahead and start lactated ringers with the number 14 angio.
For copy, IV lactated ringers, 14 gauge. We will advise. We're in the two-door area. Our ETA will probably be about 10 to 12 minutes once we're getting loaded.
As the ambulance arrives at the hospital, they're greeted by emergency room personnel as the emergency medical technicians take the patient off the ambulance. The emergency medical technicians have already inserted an IV, which is giving the patient fluids because of his blood loss.
We're going to help you in just a minute. Lay here. Go. Dr. Goldschmidt.
The physician arrives and immediately begins his evaluation of the patient.
Might want to polishing over on the other bed.
In order to thoroughly evaluate the patient, they have to remove this clothing. And they immediately begin to check his vital signs, blood pressure being very crucial.
Belly hurt you?
Yes.
How about that?
150 over 90.
How's it feel?
You want another ID?
Okay, put another ID in. Stay lean.
Chest and the other leg.
Having trouble breathing?
Yeah.
Which side hurts you?
Huh?
Which side hurts you?
Oh, both sides.
Dr. Goldschmidt, the emergency room physician, is completing his evaluation.
Yeah, that pencil?
Pulse is 100.
Emergency room personnel are ordering additional testing, including X-ray and laboratory.
Chest, stat, portable, AP pelvis.
Respiration
Right
20.
hip bib. Why don't you get a chest tube ready?
Okay. Roberta, can you call lab and x-ray?
Lab, X-ray.
Sure. We're going to help you about in just a minute, okay? It's going to hurt for a little bit.
Which side's the chest tube?
Right.
Because of evidence of injury to the thorax, the chest tube will be inserted to relieve pressure within the chest so that the lungs do not collapse. This also allows drainage of any blood that's leaking into his chest area. The physician is making certain that there is protection for the neck so that a fractured spine can be prevented if possible.
Go right down. CBC, tap across before. Lights, UN, creatinine. Yes.
Emergency room technician is now placing electrodes on the chest for measuring the electrocardiogram. The X-ray people have just arrived to take the portable films.
Okay.
Okay, the second ID is going.
Who's got the glove and betadine? Portable chest.
Are you getting the betadine here?
Yeah, I'm getting the gloves.
Here's your glove.
Where are you going to put the tube on?
Okay, you're going to feel some movement down this respiratory, we'll be drawing some blood.
Get the betadine in the form report.
Get chest X-ray.
How you doing? Where do you hurt the most? Your chest and your leg?
The purpose of the X-ray here will be to look for further evidence of injuries to the chest. The X-ray film plate has to be inserted behind the back for the picture to be taken.
Keep your head straight, steady now.
Again, efforts are made to keep the neck extremely straight so that a broken neck will not injure the spinal cord.
Anybody ask about his allergies? Are you allergic to anything?
No.
Nothing you know of?
No.
Okay, do you take any medication?
No.
You have a private doctor?
Good.
What's his name?
Dr. Kohler.
Okay.
Go ahead.
An X-ray?
Yeah.
Everyone is asked to stand back while the x-ray is taken so people are not exposed to unnecessary radiation.
Okay,
And-
I want you to take in a deep breath, sir. Deep breath. Hold it. Okay, breathe.
After the x-ray is complete, the emergency room personnel immediately return back to the patient to continue their care.
That may do the too.
I'd like to ask the emergency room supervisor to explain to us the purpose of this chest tube.
Well, this patient obviously has had a bad chest injury, and in cases like this, their lung collapses. The chest tube is nothing more than an actual tube that is inserted into the lung area and allows for air and blood to escape and allows the patient to breathe a lot better, and sometimes can be a life-saving thing. The physician paints the skin and then just quickly inserts the tube, and the patient generally feels a whole lot better right as soon as that's done.
To relieve the pressure.
To relieve the pressure and allow the lung to expand. Correct.
So we can open it.
How's your breathing doing? Is it getting worse or better?
Yeah, both hands open.
Here. Staying about the same? Let's do a little bit. We'll get something done here to help you out quite a bit. A lot better. Okay?
Give me a little process.
Personnel maintain continuous contact with the patient to reassure him throughout the procedures.
Now we'll take your blood pressure over here. What's going on over here?
Yeah. Keep it there. You know good?
Alright. It's gonna hurt a little bit. There you go. Pop.
Try to relax.
Get that in. Back it up.
One 10/70 on the blood
Turn on
pressure.
suction. Okay, breathing's gonna be a lot better now. Is that better?
You feel any different?
Oh, good. Okay.
Want another x-ray?
Yeah, get another portable chest.
My guests tonight are Ruth Pednault, RN, the supervisor of the Rideout Emergency Center, and Don Morton, general manager of the Bi-County Ambulance Service. Welcome to the Medical Explorer.
Thanks, Doc. Nice to be here.
Thank you, and thanks for arranging